So, welcome to the session on back. Rather, I would say upper back. Upper. And before we go ahead with the session on upper back, we need to know some of the important surface landmarks. And let us start with the surface landmark on the back of our skull. So on the back of our skull, if you put your hand exactly at the top of the skull in the center and go down in the center behind, this is the back of the skull. This is the back of the skull. And put your hand at the center and go down, and here you will feel an eminence on the back, and that eminence is called as external occipital protuberance. External occipital protuberance. Okay. So all of you can even feel in your own body that in the center, lower down, and the back of the skull, we feel one protuberance. For that, best way is to scroll down exactly in the center till you find the protuberance. From this protuberance, there are 9 lines. Okay. And these lines are called as nuchal lines. Nuchal referring to neck. So this is highest nuchal lines, superior nuchal lines, and inferior nuchal lines. Okay, these are superior nuchal lines. Okay. From here, if you see in the center, if you keep on feeling, suddenly at C7, level, we see we can feel the spine of C7. We can feel the spine of C7. This is exactly the lowermost part of our neck. So if you go down from the external occipital protuberance, keep on feeling, you don't feel the individual spines, but then suddenly exactly at the lowest point of the back of the neck, you see the spine of C7. And that's why the C7 spine, the C7 vertebra is called as vertebra prominens. Below that is the spine of T1, T2, T3, 8, 9, 10, 11, 12. T12. So up to T12. Okay. So up to T12, we see this spines. So what do we look at? What do you see at the side? So I'll just T4, T5, T6, T7, T8, T9, T10, T11. Okay. And T12. Okay. This one. So these are the spines. Okay. At the T7 spine, laterally, if we see from T7, grossly here is the scapula in this region on one side. So on the other side also, at the so the inferior angle of the scapula lies at the level of T7. Okay, and the scapula is like this. So this is the superior angle of scapula grossly at the level of T2, and then there is laterally there is the glenoid cavity which forms the shoulder joint. Okay, so here is the glenoid. This is sometimes called as lateral angle. This is superior angle, this is inferior angle, this is lateral angle, which is also called as glenoid cavity. And here we find the humerus forming the shoulder. Now the scapula has something called as the spine of scapula. And the upper part of the spine of the scapula is called as acromion. So this is the spine and this is the acromion. So this is the spine of scapula. This is acromion spine. Now anteriorly, this acromion will articulate with the clavicle. This acromion articulates with the clavicle. Okay. Acromion articulates with the clavicle. Now currently we are just concerned with the lateral 1/3 of the clavicle when we are studying the back. Okay. Now here I have drawn external occipital protuberance and here I have drawn C7. So in between will be C1, C2, C3, C4, C5, C6. But we don't see them. We don't see them because they are buried under a ligament called as ligamentum nuchae. Is buried under a ligament called as ligamentum nuchae. This ligamentum nuchae is a elastic ligament which is very prominent in dogs, in lower animals, because if you see the lower animals, their head is up most of the time. So the neck muscles may get strained. So there is a elastic ligament like this attached to their body, so which keeps their head straight in lower animals. In human beings, this is not so strong, but still it exists. Ligamentum nuchae. It runs from external occipital protuberance to C7. With this background, we will study the first muscle which we come across in the back after we remove the skin. So after removal of skin, we come across the first muscle, and the name of that muscle is trapezius. The name of that muscle is trapezius. Why the name trapezius? Because it is trapezoid shape. The shape is trapezoid. So the trapezius muscle takes its origin from the external occipital protuberance. So we are talking about origin, external occipital protuberance, ligamentum nuchae, and also the superior nuchal lines, the medial 1/3 of the superior nuchal lines. The medial 1/3 of superior nuchal lines, external occipital protuberance, okay, ligamentum nuchae, C7, and T1 to T12. The site of origin of trapezius muscle is medial 1/3 of superior nuchal line, external occipital protuberance, ligamentum nuchae, C7 spine, and T1 to T12 spines. So huge muscle, origin from here to here. Now let us see the insertion. The fibers from here go and get inserted on posterior border. So some fibers are getting inserted on posterior border. You can see here posterior border of lateral 1/3, posterior border of lateral 1/3 of clavicle. So these upper fibers are getting inserted there. Then the middle fibers are getting inserted on the acromion. So this is one insertion. Second insertion is medial border of acromion. Medial border of acromion of scapula. And these fibers, which are coming from below, they are getting inserted on upper border of the spine, upper border of the spine of scapula. So spine has an upper border, lower border. Acromion has a medial border, lateral border, and clavicle has anterior and posterior. So the third insertion is upper border of spine of scapula. So insertion of the clavicle upper of the trapezius is posterior 1/3, the posterior border of the lateral 1/3 of the clavicle. This is the clavicle. So lateral 1/3 of clavicle, posterior border, lateral 1/3 of the posterior border of clavicle. Middle fibers into medial border of acromion. Acromion has medial border, lateral border. So this side is lateral, this side is medial. This is anterior, so posterior. It is inserted on posterior border of clavicle, lateral 1/3, medial border of acromion, and upper border of spine. Spine has lower border and upper border. Now, in the next session, you will be studying deltoid muscle, and deltoid muscle is exactly opposite its origin. It is anterior part of the lateral 1/3 of clavicle, lateral part of the acromion, and inferior border of spine. Trapezius insertion is superior border of spine, medial border of acromion, and posterior 1/3. Now this muscle, trapezius, this muscle is supplied by spinal accessory nerve. It is supplied by spinal accessory nerve and its actions. Spinal accessory nerve is the 11th cranial nerve. Let us see the action. Now you see here the upper fibers are coming like down like this. So they will elevate. They will elevate the scapula. Right? They're coming from above when getting attached to scapula. So when they contract, they elevate the scapula. Middle fibers will retract the scapula. They will pull the scapula towards the midline, retract the scapula. And lower fibers along with upper fibers will rotate the scapula like this. They will rotate the scapula like this in whenever there is overhead abduction with serratus anterior. So every fiber of the trapezius is acting with some other fibers. So upper fibers with a muscle called as levator scapulae. Levator scapulae. Upper fibers with another muscle called levator scapulae causes elevation of scapula. Causes elevation of scapula. Middle fibers along with the rhomboids. Now rhomboids are the muscles which are attached here. I'll talk about that. They will retract the scapula backwards. So upper fibers elevate the scapula. Middle fibers, when they contract, they'll retract the scapula. Retract it towards the midline. So the scapula is protracted when we do pushing and punching move. That time the scapula is brought forwards. Now middle fibers retract. And lower fibers plus upper fibers plus serratus anterior cause forward rotation of scapula. Forward rotation of scapula as seen in overhead abduction. In overhead abduction. As seen in overhead abduction. Okay, so upper fibers with levator scapulae, middle fibers with rhomboids. So let us study the rhomboids first. Very easy. From C7, the spine of C7, with the red pen I'm drawing the rhomboids. Spine of C7 and T1. Spine of C7 and T1 is a muscle called rhomboidus minor. And T2, so they are all attached to the medial border of scapula. You're looking from behind. So this is the medial border. T2 to T5, T2, T3, T4, T5. This is rhomboid major. So now we know origin of rhomboid minor is C7 and T1. And they're attached to the root of the spine, the medial border of scapula. Rhomboid major is T2, the spine T2 to spine T5. And they are attached again along the medial border of scapula. Their action is, along with the middle fibers of trapezius, they cause retraction. They cause retraction of scapula. Retraction of scapula. Okay. Now there is a levator scapulae muscle which is not attached to the spine. It is not attached to the spine of the scapula. It is attached to the transverse process of C1, C2, and it is attached to the transverse process of C3, C4. Okay. Posterior tubercle of transverse. And from there, this muscle comes down and gets attached to the superior angle of the C4, superior angle of scapula. Levator. See, levator means one which elevates. Levator scapulae. Levator scapulae. So along with the upper fibers of trapezius, levator scapulae. Now, levator scapulae muscle. What is its action? Elevates the scapula. Name suggests levator scapulae. Elevates the scapula. Levator scapulae. Elevates the scapula. Okay. Now one more muscle which is there in this region. Okay. This is rather the last muscle which we are studying today. And that muscle is, its origin is almost from the iliac crest. We wear our pants, our jeans on iliac crest. Okay, we feel when we put our hands, this is the iliac crest. So on the posterior 1/3 of the iliac crest, so iliac crest, sorry, I have drawn it little laterally. The iliac crest will be somewhere here like this. Okay. And from here it takes origin, this muscle. Okay, the fibers are there. And also T7, so up to T5 we said is rhomboid. Now from T7 to T12, there are fibers. T7 to T12, there are fibers. So this is latissimus dorsi. This muscle taking origin from T7 to T12 spine. That means C7, T1 was rhomboidus minor. T2 to T5 was rhomboidus major. T6, no major muscle attached. Okay. So T7, sorry, I have written T7 is here. T7, T6, nothing is attached. T7 to T12, then lateral 1/3 of the iliac crest, lateral 1/3 of the iliac crest, the lower 4 ribs, and inferior angle of scapula. Inferior angle of scapula, after touching it, the latissimus dorsi goes and gets inserted on the intertubercular sulcus. In the intertubercular sulcus, there are two muscles, pectoralis major and teres major and latissimus dorsi. So we say lady between two majors. So here is intertubercular sulcus of the humerus, where on this intertubercular sulcus, there is latissimus dorsi getting attached in between pectoralis major laterally and teres major medially. Okay, lady between two majors. So there is pectoralis major, teres major, and in between is latissimus dorsi. That's the insertion. So you can see this muscle, latissimus dorsi, is taking origin from the pelvic girdle of the lower limb. and getting inserted on the shoulder girdle of the upper limb. So the muscle which connects the lower limb to the upper limb is latissimus dorsi. When it contracts, it brings about extension. Okay. So latissimus dorsi will bring about extension. Latissimus dorsi will bring about medial rotation. It will bring about adduction. Okay. This all is useful in climbing. So along with pectoralis major, we have one more muscle, latissimus dorsi, used for climbing. It is used for swimming. So it is a swimming muscle. Till now we have seen pectoralis major is climbing muscle, serratus anterior is boxer's muscle. And now we have come across latissimus dorsi, which is the swimming muscle. Used in climbing, pulling. It is used because it is there on the side of the back. So it is used in violent expiratory actions like coughing, sneezing. Okay. It is basically a climbing muscle and it holds the inferior angle of scapula in place. The nerve supply of this muscle is nerve to latissimus dorsi, also called as thoracodorsal nerve. Thoracodorsal nerve. This thoracodorsal nerve is a branch of posterior cord of brachial plexus with root values C6, C7, C8. Thoracodorsal nerve. Nerve to latissimus dorsi from posterior cord of brachial plexus. Okay. So again, I'll fastly revise the muscles in the upper back or other muscles of the back also. First is trapezius, taking origin from the medial 1/3 of the superior nuchal line from the external occipital protuberance from the ligament of nucleus C7 and spine T1 to T12. The insertion of trapezius is upper fibers on the posterior part of the lateral 1/3 of clavicle, middle fibers on medial border of acromion, and lower fibers at the upper border. Levator scapulae takes origin from the transverse process of C1, C2, and posterior tubercles of transverse process of C3, C4, and it gets inserted on the superior angle of scapula. It is supplied by a branch of C3 and C4 nerves. Okay, superior angle of scapula, it gets inserted. Rhomboids minor is from C7, T1. Rhomboids major is from T2 to T5. Get inserted at the root of the spine, minor, major along the medial border of scapula. So most of these muscles get inserted along the medial border of scapula, and at the lower angle is latissimus dorsi. But this latissimus dorsi also takes origin from the posterior 1/3 of iliac crest, spine T7 to T12, inferior angle of scapula, and insertion is on the humerus at between the two major muscles. Between the two major muscles, the nerve supplies thoracodorsal nerve. Thoracodorsal nerve, also called nerve to latissimus dorsi, branch of the posterior cord of the brachial plexus C6, C7, and C8. The trapezius, the actions where upper fibers along with levator scapulae elevate the scapula, middle fibers along with the rhomboids retract the scapula, and lower fibers along with upper fibers and serratus anterior cause forward rotation of scapula. Levator scapulae action is elevation of scapula. Rhomboids minor and major action is retraction of scapula with the middle fibers of trapezius. Levator scapula elevates scapulae muscle, elevates the scapula along with upper fibers of trapezius, and lower fibers of the trapezius along with serratus anterior and upper fibers cause forward rotation. Latissimus dorsi, the action is adduction, medial rotation, adduction, extension, as in climbing and swimming. Violent expiratory acts like sneezing, vomiting. Okay, and it steadies the inferior angle of scapula. So that's all about the muscles of the. That's all about the muscles of the back. Now there are some important triangles which are there in the in this region, and let us study these triangles. Okay. Now, when we see that we have seen the trapezius muscle goes like this, right, and comes from basically One side trapezius muscle is like this, other side trapezius muscle is like this. So these are the fibers which are going from T12 and from T1, okay, up to C7 and external occipital protein. So this is the lateral border. This is the lateral border. Okay. And then there is the upper border of latissimus dorsi. There is the fibers of latissimus dorsi also. Latissimus dorsi upper. And then there is the medial border of scapula. The scapula is medial border of scapula. So this is medial border of scapula. This is lateral border of trapezius, scapula, and this is upper border of latissimus dorsi. So this triangle is called as triangle of auscultation. Triangle of auscultation. Okay, below that is nothing but 7th and 6th intercostal space. There's a sixth intercostal space, 7th, and there is the 7th rib over here. Basically, there are no other muscles in this region except for these ribs. So directly we can auscultate the lungs. Okay, we can directly auscultate the lungs, and on the left side, below this, on the left side is the cardiac orifice of stomach. Okay, so we can also feed the tympanic, the sound of the swallowed liquids from the stomach in this triangle. So triangle of auscultation bounded medially by lateral border of trapezius, laterally by medial border of scapula, and inferiorly by upper border of latissimus dorsi. This is the triangle of auscultation. This is located in this area. Then there are some other triangles which are there in this region. So, like for example, if this is the iliac crest, this is the iliac crest, and in the iliac crest, if we are looking at the iliac crest, there is a muscle called as external oblique muscle of the anterior abdominal wall, external oblique muscle, and the latissimus dorsi taking origin from the iliac crest is going like this. Latissimus dorsi taking origin and is going upwards. It is going upwards. So this is latissimus dorsi, this is iliac crest. Okay. This triangle is called as lumbar triangle of Petit. Lumbar triangle of Petit. Okay. Bounded medially by the lateral border of latissimus dorsi, laterally by posterior border of external oblique muscle, inferiorly by iliac crest. I'll repeat, it is bounded medially by lateral border of latissimus dorsi. It is bounded laterally by posterior border of external oblique muscle, and inferiorly by the iliac crest. This is called as lumbar triangle of Petit. Now, because there is a space over here, there can be a hernia, lumbar hernia. Lumbar hernia, that is some abdominal fat, some organ, some part of omentum, some part of mesentery or intestine, anything can protrude through this area, that will be called as lumbar hernia. Okay. So that this triangle of auscultation, where there are no other muscles, directly we can feel the 6th and the 7th intercostal space and the 7th rib, and we can feel the lungs. And also deep down is also the cardiac orifice of the stomach, especially on the left side, where we can feel the solid fluid. So these are some important landmarks in this area. With that, we stop the discussion on the back, where we studied trapezius muscle, we studied levator scapulae, we studied rhomboids minor and rhomboids major, and we studied the latissimus dorsi muscle, and we studied the two triangles of, or one triangle of auscultation, and another is the lumbar triangle of Petit. With that, we stop this session. Thank you so much.